What is the difference between a psychologist and a therapist? Which one do you need? Psychologists and therapists are the titles that come up during every conversation about mental health professionals. The terms are used interchangeably, with several people not knowing the difference between the two. Both are educated and trained in therapeutic treatments. However, the kind of education they receive and the types of treatments they can offer differ. Many people are not aware of these differences. So let's take a look at them and figure out which one you need according to the situation. What are the differences between a psychologist and a therapist? Both terms are so interchangeably used that even professionals in the field often fail to make the distinction between them. Psychologists with a doctorate-level education may often adopt the title of therapist or psychotherapist. Those who stick around the master's education are often called counselors. To discuss it in detail, psychologists are treatment-focused professionals who rely on psychological research and aim to further it. They are essential medical doctors who use research to form the basis of their treatments. But psychologists do not have the credentials to prescribe medicine to their patients. Psychologists rely the most on behavioral research, which offers details on how people respond to stress and how they deal with mental health problems. Behavioral research also contains details of clinical trials and tests. On the other hand, counselors and therapists, while treatment-focused, are more reliant on rhetorical and philosophical theories rather than research. While psychologists are certainly more learned about their field, therapists gather professional experience and utilize their theoretical prowess in the field to offer treatments to patients. Similarly, a therapist cannot prescribe medication as well, with that right being held only by psychiatrists. To summarize the difference between the two, a psychologist has more in-depth knowledge about their field, but a therapist forms a strong theoretical background and social knowledge. Furthermore, a therapist cannot make a diagnosis without being under the direct supervision of a psychologist. Which one do you need? Selecting between a psychologist and a therapist can depend on your situation. However, that does not change the fact that both professionals have significant overlap when it comes to their treatment and areas of expertise. Either of them is a good option and a starting point for general counseling, grief counseling, marriage counseling, and dealing with divorce. Both can help you deal with mental health disorders such as anxiety and depression. The key difference between choosing either depends on the level of education you are looking for. A psychologist has more education than a therapist and is an expert in driving change through behavioral and thought patterns. However, therapists can often help you in the same manner, with differences between them being quite minimal in a professional capacity. However, costs do tend to differ between the two. A psychologist with a private practice is bound to cost more than a therapist. These factors should help you decide whether you need a psychologist or a therapist.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.